Hi friends, welcome to classes by Lab Doctor. In today's class, let us study some details about our ESR or erythrocyte sedimentation rate. So, the definition of ESR is, it is the rate at which the erythrocytes settle down at the bottom of the tube, okay, at the first 1 hour. That is called as erythrocyte sedimentation rate. The rate, the speed, किस गति में एरिथ्रोसाइट इज आरबीसी, द रेड ब्लड सेल्स सेटल होते हैं, सेडिमेंट होते हैं, नीचे बैठते हैं एक ट्यूब में जब हम रखते हैं, तो उस रेट को, उस स्पीड को हम एरिथ्रोसाइट सेडिमेंटेशन रेट कहते हैं. ये एक नॉन स्पेसिफिक टेस्ट है, मतलब दिस विल नॉट टेल यू द स्पेसिफिक रीजन. यस, इस पेशेंट को बोन में इन्फेक्शन है, यहाँ पे इन्फ्लेमेशन है, नो, बट इट टेल्स दैट देयर इज सम काइंड ऑफ अ ब्रेकडाउन, tissue breakdown happening in your body, and very commonly ordered test, that is your ESR. Erythrocytes are your red blood cells, and the sedimentation rate or the settling rate is the time which it takes for your red blood cell to settle at the bottom of the tube. So this is the tube, this is the blood inside it. Here now you can see after 1 hour the blood cells, the RBCs have separated from the plasma, and these RBCs have settled down. So what time this RBCs will take to settle down, that is called as the erythrocyte sedimentation rate. So in few of the conditions, like whenever there is an inflammation, or in certain kind of cancers or certain blood disorders, etc., this rate at which this erythrocyte settles down, it might be altered. So that is why ESR is used as a non-specific marker. It gives you an idea, yes, something is happening in your body, some kind of a breakdown, some kind of an inflammation is happening in your body, but where it is happening, it will not tell you. ये नहीं बताता है कि inflammation कहाँ पे हो रहा है, ब्रेकडाउन कहाँ पे हो रहा है, बट यस, बॉडी में कुछ हो रहा है जिसके वजह से आरबीसी सेटल हो रहे हैं एक स्पीड में, ओके, ज्यादा स्पीड में वो सेटल हो रहे हैं. तो दैट इज द इम्पोर्टेंस ऑफ दिस ESR. इट इज वेरी चीप, we can come to know very soon, and very handy. That is why ESR is used routinely in clinical practice. There are different stages of ESR. We take it as 1 hour. क्यों 1 hour लेते हैं? Because for the initial stages, जो rouleau formation हम बोलते हैं, which we will see in our later slides, it will take around 10 minutes. That is called as the lag phase. First there will be rouleau formation. Then there will be the actual stage of settling or the setting. That is the around 40 minutes. And then there is a stage of packing. That is around 10 minutes. So 40, 50, 60. So we take it as a standardized time. 1 hour, why we have to take? Why can't we take more, or why can't we take less? Because the stage of this sedimentation takes place in these stages. Stage of rouleau formation or lag phase, which is around 10 minutes. Stage of sedimentation or setting, which is around 40 minutes. And stage of packing, it is around 10 minutes. And 1 hour is the standardized time. So we take that rate at which the erythrocytes settle down at a period of 1 hour. Okay, so 1 hour because it is a standardized measurement. So that is why we take it as 1 hour. So here you can see the different tubes, and here you can see how the the erythrocytes, the RBCs have settled down. So here you can see the tube, and here you can see how the RBCs are settling down, and this is the clear one, clear yellow thing is your plasma. So here you can see a tube here, and here you can see the RBCs have settled down. So what we read this ESR as around 18 mm, isn't it? Because 10 and here 20, so it is around 18 mm at the end of 1 hour. So the ESR of this patient is, it is settling down at a rate of 18 mm at the end of 1 hour. Okay, so normally in men we take it as 0 to 15 mm and in females we take it as 0 to 20 mm if they are less than 50 years of age. So I've told you that ESR is a non-specific marker. It doesn't point out, okay, ESR is high, okay, patient is having rheumatoid arthritis, ESR is high, patient is having SLE. No, it doesn't indicate that. It is just telling you, it is indicating you that yes, something is happening in the body. There is a tissue breakdown. There is some kind of an inflammation. Where is the inflammation? We need to do extra tests and find out where exactly is the inflammation. It is just a alert sign saying you that some kind of a breakdown, tissue damage, tissue breakdown, inflammation is happening in the body. So that is why you will have to do specific tests to find out where exactly is the tissue breakdown, where exactly is the inflammation. So that is why doctors use ESR along with other tests to diagnose or monitor also. If the ESR was high, after they treat, the ESR will come down to monitor the disease, certain infections, autoimmune diseases, certain cancers also. So that is the use of this ESR. So there are other markers also. ESR is not the only inflammatory marker. There are other markers which say that there is inflammation, like you have the C-reactive protein. That is also an acute phase reactant. Whenever there is an acute inflammation, that time also CRP is raised. And this CRP, this is a protein, and this protein is produced by your liver in response to inflammation. You have your WBCs. The WBC count is raised whenever there is inflammation. It says that there is an infection, there is an injury. So WBC count also gives us an idea, yes, body, there is some kind of an inflammation. Fibrinogen. Fibrinogen, it is a clotting protein, and it is a protein which is produced again by the liver, and it also increases during inflammation. Why it increases? To repair the tissue damage, to fight the infection, to restrict the inflammation. This fibrinogen is produced. So whenever there is an acute inflammation in the body, fibrinogen is raised. Also procalcitonin, that is also increased whenever there is bacterial infection, inflammation, etc. So there are certain other cytokines, like you have interleukins. Interleukins are increased in inflammation. Tumor necrosis factor alpha, that is increased during inflammation. And specifically if you want, fecal calprotectin. So this is the one which is produced by the intestine whenever there is an inflammatory bowel disease. So to see if there is an actually inflammatory bowel disease or how the patient is reacting to the treatment in IBD, we use this fecal calprotectin. So there are specific markers like your fecal calprotectin, and there are other non-specific markers like ESR, CRP, fibrinogen, interleukins, tumor necrosis factors, etc. So what are the uses of ESR? The main use of ESR is that it helps us to let us know that there is some kind of an inflammation or tissue breakdown which is happening in the body. Now that inflammation could be because of a bacteria, because of a fungus, because of a virus. It could be a lung infection, it could be a bone infection, it could be skin infection, it could be any infection, any inflammation. The ESR will rise. So to diagnose the infections, we use ESR. And suppose we diagnose the infection, we put the patient on treatment, then to see how the patient is responding to the treatment, to monitor the patients also, we use this ESR. It is used to diagnose acute conditions as well as chronic inflammation. I have told you, like when suppose if there is a chronic inflammation, we put them on a treatment, we put them on medications. Like in case of TB, whenever there is TB, the ESR is high. When we put them on a treatment, ESR comes down. So to monitor chronic inflammation, we use ESR. Also to assess how the disease is progressing. In case of rheumatoid arthritis, lupus, there the patient can have flare-ups. There the patient can have recurrence. So to know how the disease is progressing, there also we can use this ESR. And to see if your anti-inflammatory medicines are working, To see that, we use ESR. It is used as a routine health checkup, because sometimes, when we do a routine scanning, we come to know that ESR is high, and then we start evaluating what might be the reason for raised ESR. So mainly ESR is a non-specific marker which is used for to know whether the body has an inflammatory response, and also to monitor the disease progression and to see how effective the treatment is. So we have told that, in inflammation, the ESR is very high. Basically, the body, there is tissue breakdown and the ESR is very high. That is because of certain proteins which are produced in inflammation. Whenever there is an inflammation, because of an infection, or there was an injury, or there was an autoimmune episode, whatever, there is the response coming from the body reacts by producing what? Acute phase reactants, proteins, fibrinogens, etc. So what happens? These proteins, especially these fibrinogens, globulins, etc., what they do, they will help the red blood cells to come together. Okay, they will see that the negative charge which is there around the red blood cells, they are neutralized, and they will pull the red blood cells together, and they will make the red blood cells to settle down. They'll pull them. Okay, so the rate at which it settles is higher. That is why the ESR is increased. We will see actual mechanism of ESR also, but basically understand that in inflammation, because of these proteins, they will pull the RBCs down at a faster rate, and when the RBCs are settling at a faster rate, your ESR is going to go up. Okay, so that is why in inflammation the ESR is high. So these were the few uses of ESR which I have already told you. One is monitoring the disease progression, and to diagnose certain diseases, to evaluate the effectiveness of treatment, and in routine health checkups, the doctor uses this ESR. So in the next classes, we will discuss about the actual mechanism of how this ESR works. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.